organizers of this, I would call it a seminar. Thank you, they have really taken care of me since I came to Indiana on Saturday. Thank you, Dr. Byron. So my name is Oluwasegun Akinyemi. It's a Nigerian name. The Oluwasegun means God will always bring victory. So I always like to call my name full Oluwasegun. I have no distinctions. So I will talk a little bit about myself so that you can understand my background. I am initially from Nigeria, from the western part of Nigeria. I trained as an obstetrician and gynecologist in Nigeria and completed my specialist training in 2017. That was me over there receiving my diploma. I am married with 3 kids to a beautiful woman by the name Irene. I love to eat a lot of food. I love Nigerian food. So what I do is everywhere I travel to, I always look for a Nigerian restaurant where I usually go with friends. And this is me in Atlanta, in one of the Nigerian restaurants. I also like to travel. So this is me in London at the British Museum earlier this year. And this is me in Paris at the Eiffel Tower. So, how did I start the journey of moving from clinical medicine to just going straight into research? It started when I had what I would refer to as a wake-up call. As an obstetrician and gynecologist, I was to stay in the hospital while women come to me and they get treated and get better. But I have a lot of challenges doing this because a lot of these women were coming at an advanced stage of complications. I've had cases where I'll be summoned that there is a patient outside of the hospital, and when I will get there, the woman will have bled to death. Possibly she has been driven over like 3-4 hours from a village to our hospital, which is the biggest hospital in the state and attends to more than 500,000 people. So I got disenchanted losing so many women, a lot of these women coming and dying. If you can look at when I left Nigeria in 2017, maternal mortality rate then was 875 for every 100,000 live births. That's, we lose 875 women for every 100,000 live births in Nigeria then. If you want to understand the magnitude of the problem, you look at what is happening in the United States. In the United States, the US loses about 39 women for 100,000 live births. And when you delve further and look at minority population, black women in the United States is double of the figure I called. So for black women in America, America loses about 70 black women for every 100,000 live births, while Nigeria was losing 875 women for 100,000 live births. So it's very discouraging for a physician, for somebody who is staying in the hospital. And unfortunately, I left in 2017. When I checked this number in 2021 now, in 2021 now we are losing about 1,047 women for every 100,000 live births. So that means the problem is still getting worse. And one of the issues is doctors moving out of Nigeria, a lot of Nigerian medics coming to the US, coming to go to Britain, Australia, Canada. And one of the major issues then was that less than 57% of the women who are pregnant will actually have antenatal care. Those are cares that is important to make sure that you have good quality outcome during pregnancy. Compared to the United States, less than 13% of women will not visit the antenatal care, meaning about 87% of women will attend antenatal care during pregnancy in the United States, while only this number is what we have in Nigeria. So I got talking, I got tired, I got frustrated with losing women. I wanted to reach out to more people. I wanted to make more impact. I was tired of just sitting down in the hospital while these women come to meet me and I'm able to save 1 woman per time. So I wanted to do something big. I wanted to do something that will have more impact, that will save more women's life. And that is when I started to think about research. Like, let me do research. If I learn to do research, I have this research published. This research may be able to influence policies. And if this research influence policy, then we will be able to save more women. I will be able to be instrumental in saving more women than simply with me sitting there in the hospital and saving one woman per day. So that is how I started my research journey. So to do that, I applied for a master's in public health at Western Illinois University, not very far away from here, where I completed the master's program. During my master's program, I was very, very aggressive about research. I wanted to learn because when I left Nigeria, I did not know so much about research. I had only one publication when I was in Nigeria, and that was my thesis following my completion of my specialist training. So I made sure my exit option, that was what we call it. I made sure my exit option was a thesis that was going to do a study. And I decided to look at a study that I'm going to show you now. But this is me presenting one of our topics then in school. You can see my passion, improving antenatal care. I wanted to do something about antenatal care. I just wish I could go straight onto every part of Nigeria and bring every woman that was pregnant to the hospital so that we can save all these women. So I noticed that I needed to learn the skills with which I would be able to do all that. So when I completed my master's program during the COVID-19 pandemic, and that was a very, very stressful time in America. Completed my master's program in 2020, and that was me presenting my thesis. My thesis then was focused on impact of obesity on academic performance of Western Illinois University students. How did I come to that? Moving around Illinois, when I got to the US, I saw a lot of people that were obese, and it was very strange for us in Nigeria. Obesity rate in Nigeria is less than 10%. So it was like, why is everybody like this? So I understand when I get to a mall and I wanted to buy my size, I would not find my size. And then my friends would just laugh and tell me to go to the children's section, and you only get your size in the children's section. So it was like obesity was so normalized in America. So I decided I was going to do something about that too, and study something about obesity. And so I made my thesis was on the impact of obesity on the academic performance of Western Illinois students, which we did and was published. And then luckily for me, I was successful enough to have my third child. As I was graduating, I was having my diploma. I was also getting a gift of a bouncing baby son from God. So during the pandemic period when I was doing my internship, we were given the option of working from home. But this hospital, I did my internship at the Catholic Memorial Hospital. And I was given the option of staying at home. But we have this data set at the hospital that needed mining. And I made a decision for myself that rather than stay at home, I will go to the hospital every day. During the period of the pandemic, and we were told to stay at home. I was going to go to the hospital to learn more about research, to practice more about this research. You know, when you have a passion, you just have to get committed. You have to throw yourself into it. You have to take every opportunity. I will tell you, every skill I learned about research, the major foundation of those skills were built during this pandemic period. When people had some of my friends then were staying at home, I was going to the hospital. I was risking everything, but I was improving myself. So I had a presentation then, I had a publication during that pandemic, and we were looking at the impact of pre-pregnancy body mass index. We were trying to look at body mass indexes of women, especially obese women, overweight women compared to women with a normal BMI. And let's see how that affects pregnancy outcome. That was what I achieved during that period. And that was me presenting my findings to the obstetrics and gynecology section of the hospital. Following that, I got a job. I was invited to function as a research associate at Howard University College of Medicine. And for me then, that was a big job. Some of my function activities include to plan, to conduct, and report on original research. I was also in charge I supervise the whole research operation of the Outcome Research Center of the Howard University College of Medicine. I am involved in clinical design of clinical research, also to identify appropriate research methodology to test clinical hypotheses. Some of my work also includes reading, critique, and also to present published clinical manuscripts, and also to perform multivariate analysis of large clinical database, and also to mentor students, to mentor medical students, resident doctors, even attendings who are in the process, who are willing to learn about research. So you can see an improvement, a gradation in my expertise. And I must tell you that the first time I got this job at Howard, I was the first person who will be having an MPH from Western Illinois. Every other person that was ahead before me that had that job were people who had an MPH from Harvard. So initially there was this, we call it a name, it just escaped me. Yes, I was not sure of myself. I was new, I was doubtful, I was always doubting myself. It was like, are you sure I can do this? Am I qualified to be here? But I had a friend then that was always talking with me, and he would say, every training you have ever had in your life, all the trainings in medical school, in Nigeria, even in your master's program, all these trainings means that you are qualified for this job. So at that period, it was very challenging. I want to encourage you because you are going to find yourself in some situations and it's going to be like, am I really a good fit? Am I qualified to be here? But really you are. So, kept that encouragement. I kept doing my work. I kept having my publications, presentations, manuscripts. I started getting reviews from people. I started getting encouraging words from people, and that kind of built my confidence. So that was my experience at Harvard. So, following that, with the level of exposure to research, I found out that, okay, I have still not achieved my dream. I still wanted to know how to design a kind of research that would affect policy. So that was still deficient. Some of my analysis, I found that I need to improve more, I need to know more. So I wanted to do a PhD. And when I started talking about a PhD among my colleagues, people were like, you're a doctor, go and do residency. I wanted a PhD, it was there, the fire was right in my bones. But there was a lot of discouragement until I met somebody who is a vascular surgeon at Howard and encouraged me, and he just got his own PhD, so he encouraged me and told me to apply for this program at University of Maryland School of Public Health, Health Policy and Management. And this is me, excited. These are my cohort. You can see me excited, learning about Markov model, talking to my colleagues, sharing my class, as in the things I learned. And that, for me, I keep telling people, has been the biggest education of my life. It's so life-changing for me. And I want to throw that at you. You can be doing a PhD. I have met people who actually completed a PhD and knew nothing about research. I've met people who went to PhD and knew nothing. It was like, you can see, it's as if they had never passed through a PhD training. So it's actually dependent on you. I have mentored a lot of people where I have told them, you are going to a master's program, you are having a PhD program, you have to really, really get yourself into the system. You have to make sure you want to really get as much as possible from that same program. If not, it is possible for you to finish an MPH, to finish a PhD, and you will not be different from somebody who had not even gone to that school. So I threw myself at it. I was always asking questions. I was always having extra meetings with my professors. Like for one of the classes, cost effectiveness analysis was so important to my passion, my life. I was always going to my professor. And at the end, I got what I wanted from that class. So I'll say, what are the lessons so far that I have learned? During this PhD program, I have learned how to do a cost effectiveness analysis. It's very important in my field because we don't only just want to throw out our research findings. We want to also be sure that these interventions that we are proposing are cost effective. So that has been a passion. I went all out. I presented my paper in London Royal College of Obstetrics and Gynecology around June this year on cost effectiveness analysis. What I just learned in the spring semester, I learned about grant writing. I've been able to write grant for some of our attendees now. Now, another major thing I learned was the intersection of politics and health policy. When I left Nigeria, I wanted to do research, and the research was research that was going to affect policy. I wanted to do research published that was going to affect policy. I thought it was that easy until I had lectures of health policy in my PhD class, and I discovered that there is a significant intersection between policy and politics. You can have your research, you can prove that a particular intervention is good, but if you don't have it sold to the politicians in a way they can understand it, then you are really not going to make any impact. Like you look at the Affordable Care Act, you have to be able to show that this Affordable Care Act is going to increase access to healthcare, and then you have to be able to convince the politicians. So there is actually, you can't do it on your own. You have to be able to merge the intersection of politics and health policy of your research findings. Your research findings has to be research that will have real life implications. So that's one of the things I tell my friends, my mentees, that any research you are doing, you must ask yourself, this particular research, how is it going to affect public health, population health? How is it going to affect policy? That will guide you to make sure what you are doing are research that will have real life implications. So these are just some of my publications. This particular study was, for me, it's mind-blowing because this study was cited on the MSNBC. That was like having your work cited on CNN and less than 7 years in the United States. This is another work where we looked at distressed community index. We look at where people live and how socioeconomic neighborhood poverty affects firearm injuries in America. We did a study on renal medullary carcinoma, and another one. This was my study in Nigeria, my thesis for my specialist training in Nigeria. Some other studies. This is one of the biggest journals for obstetrics and gynae in America, obstetrics and gynecology. We have 2 publications with them. We have this post-operative atrial fibrillation. This was one of my, I always say this is one of my studies that I never believed was going to be published, and got published in a big, very prominent surgical journal. And then this particular was another big one for me, diabetes. We presented this at the American Diabetes Association earlier this year. So we have presentations. These are some of by virtue of my work, I travel all over the country, outside the country to present my work. This was me presenting my work at the American College of Obstetrics and Gynae in Maryland earlier this year. This was me at the American Public Health Association in Georgia. This was me in international. This is the biggest obstetrics and gynae conference worldwide. So I presented here International Federation of Obstetrics and Gynae 2023 in Paris, and our work was chosen as one of the best 20 in the world. So the conference registration, everything was paid by FIGO. This was me presenting at the Society of Black Academic Surgeons in Michigan. It's very important to me because this time I'm presenting among Black academic surgeons. And then this is me in London presenting my work at the Royal College of Obstetrics and Gynae. I also function as a peer review for some very prominent journals, like the Obstetrics and Gynae, British Journal of Obstetrics and Gynae, International Journal of Obstetrics and Gynae, Journal of Surgical Research, British Medical Journal, American Diabetes Association Clinical Diabetes, Journal of Racial and Ethnic Health Disparities, Perspective in Public. These are just a few of what I do. And then I also have pictures here of some people who have had significant influence on my life. I told you about Dr. Hughes. This is Dr. Hughes. He's a vascular surgeon, a professor of surgery at Howard University College of Medicine. He was the only person that accepted my dream of being a professor of medicine, wanting to do a PhD, and he really encouraged me. This is the department chair, Dr. Terence Fulham, who is the chair of the Department of Surgery at Howard University College of Medicine. This is my assistant. He's Tehas. He's a surgeon, initially from Ethiopia. And this is Dr. Conwell. And Conwell is one of the most prominent professors of surgery in America. So these are people I work with, and the way we do it is that once I have my results, we sit down, we discuss the results. Dr. Conway is particularly so good about numbers. He will look through your work. At times it makes you feel really bad, like picking out all the errors in your work, and at times it's real, you struggle, but you have to have the right perspective that these people are trying to make me better, they are trying to make my work better, and I've learned so much from them. And also, these are some of the people that I partnership with. Initially, when I started research, I thought I could do it on my own. I would do the analysis, write my manuscript myself, and then I was getting to a level where you spend for 6 months, I have the manuscript sitting. It's there. And then you get a response from the reviewer, I will have no time to respond to that. You have another 6 months. So I learned about the power of collaboration, of you training people to be able to do your work. You train them here, you trust them. So these are people I work with. This is Moji, she's a PhD student in epidemiology at the University of Alabama at Birmingham. This is my very good friend, who's also more like a mentor to me. He's also a psychiatrist. He's at Boston University College of Medicine. This is Tejas, the surgeon at Howard. This is Ofure. Ofure is in Canada. He's also an obstetrician and gynecologist. This is Tayo. This is a family physician, also my classmate and very good friend. This is Siobhan. She's a surgeon also at Howard University College of Medicine from Nigeria. This is one of our medical students. Her name is Eunice, and she's learning how to submit manuscript, and she's been doing it super. And then this is Kinda, also one of the residents at Howard University College of Medicine. So these are few of the people I work with, trying to let you see that to achieve your goal in life, you need to collaborate, you need to work with people, you need to trust them. At times when you are passionate about something, it's difficult for you to really you don't want to give responsibilities, but you really have to learn that it's important for you to train people and to let them be, to train them and trust them enough to let them be. And then you'll be surprised at the level of the work, the number of publications that were churning out from Howard is so huge, and then you wonder, it is because we are collaborating, it's just not one person that is doing this work. So these are some positive feedback. We have some series of awards, we have letters of commendations from different professors when we presented our work. We have calls for grant applications, and then we've also have news medias in Boston, news medias MSNBC, as in referencing our work in their news outlets. So you ask me, what is the future? For me, I want to be a professor of medicine. One day I want to work either with the CDC, World Health Organization, or the National Institute of Health, trying as much as possible to influence policy that is going to affect population health. Initially it was women, but now it's more expanded, both for women, minority group, and everybody, whether white, black, Hispanics, non-Hispanics, across board, male, female, adult, children. I am passionate about public health. I want to influence policy, and I'm trying as much as possible to learn and equip myself with the skills that will allow me to be able to do this. So I'm just going to run through one of our studies. So this is the particular study where was recently published, where we looked at factors that are associated with suicide, self-inflicted injuries. We looked at factors that predict women who present to the hospital having attempted suicide. So we did this analysis. This is an introduction of our study that suicide is beginning to become a major cause of significant morbidity and mortality in America today. It's actually responsible for about 15 deaths per 100,000 of the population. And our study delved into factors, profiles of patients, of women who are more likely to attempt suicide, who present to the hospital on account of suicide. So, like I said, the study objective was to determine risk factors for attempted suicide among women. We focused on women between the ages of 18 to 65 years, based on the United States, and we also tried to see the interaction of race and socioeconomic status. How does that affect this occurrence? We utilized the National Inpatient Sample Database. This database has a 20% stratified sampling of all hospital admissions in the United States. So you can use it to explore any kind of condition, you can use it for anything, and here we focus more on self-inflicted injuries or suicide. So this is our baseline characteristic. We looked at about 1 million women, slightly more than 1 million women who presented to the hospital having attempted suicide. 17.1% of these women were white, so it's majorly a white problem. About 9.2% black, 7.7% Hispanics. When you look at the distribution, you look at among women, black women, close to 50% of these women who attempted suicide are in the lowest socioeconomic status. They have the lowest income quartile. But among whites, 21.8% are the highest income quartile. Close to 40% of white women who attempted suicide utilizes private insurance, while about 40% of these women among blacks utilizes Medicaid. Now, we look at other factors. These are just our baseline characteristics. Major findings will be in our multivariate analysis. In the multivariate analysis, we found out that the highest age group that are more exposed to attempting suicide in the United States are women between. Now, you need to know that we need to be contextual in interpretation of this. These are only women. We are not looking at men. And these are people who attempted suicide. So they are different from people who actually complete the suicide, because people who complete suicide are more likely to be white, to be males, and to use firearms. So, but this particular study, we are looking at women. And women, when they attempt suicide, are more likely to use poisons, chemicals. So this, I want us to interpret that in that context. So among these women, the highest age group, the age group with the highest incidence is between the ages of 18 to 30 years. And when we compare black, Hispanic, others race ethnicity to white group, white race, white women have the highest risk compared to blacks to Hispanics. Now, look at smoking. Among smokers, the risk increases by 1 and 2 folds. But among women who are exposed to intimate partner violence, they are 6 folds more likely to attempt suicide. That means if you have a woman who is, even without mental health conditions, who is constantly exposed to intimate partner violence, they are more likely to present to attempt a suicide. And they're more likely to 6-fold. That's the highest odds here. And then I want us to look at the intersection of this. Is very important to me also. If you look at white women here, these are the white women, these are the quartiles, this is the lowest income quartile, this is the highest income quartile. Among white women, this is the reference. You can see among the white people, white women have the highest incidence of suicide, but there's not so significant difference between white women with the lowest income quartile, second, third, and fourth. But by the time you look at black women here, these are black women in the lowest income quartile. The risk of attempting suicide is low. Black women, when they move to the second income quartile with increasing income, socioeconomic status, the risk increases here, but this time around is not significant. But by the time they are in the third and the fourth quartile, the risk increases. That is strange. And that's an observation we also observed among Hispanics, that as you move, the higher socioeconomic status is associated with higher level of suicide, which is a message for the society. Everyone wants to be fine. We want to improve in our socioeconomic status. But why are we having that among minority groups, among minority women? Why are we having higher socioeconomic status associated with higher level of attempting suicide? Does it mean that this particular group of women are more exposed to psychological challenges, stressful conditions that are more likely pushing them to attempting suicide? And I guess that's one of the reasons why this study was cited by MSNBC, Boston University news outlet, because we want to be fine, we want to move up the ladder, but moving up the ladder is also increasing our risk of suicide. What is happening? And how can the society really help to make sure that women can move up the socioeconomic status without increasing level of exposure to risk of attempting suicide? So that is, in a nutshell, a little story of my life, what I'm doing presently. This is a conclusion of what we have been doing. And at the end, I said, research should be fun. It should feel like, just do this, right? You can't actually make it fun. Thank you. And I'm grateful for the opportunity to talk to you guys. I'll be happy to answer your questions. Thank you.